To our welcome and to our partner session this month. This is the first HRSN partner session for April. I am Satya Sandipani Pradhan. A little bit of introduction about me. I've recently joined OHA as Senior Community Engagement Analyst. And Jessica, who you all know, has been conducting these partner sessions till now, and she has graciously handed it over to me, and I hope to do as much a good work as she has been doing. So going forward, I will be holding these sessions, and one of my most important aims with this while holding these sessions is I learn from you how we can make these sessions better and more informative and supportive of your work and yourself. So please feel free to share your suggestions and comments with us, and we'll work on them as far as we can possibly do that. And then let's go to the second slide, please. Yes. So as you all are aware, today we are working we'll be focusing on Medicaid payments and fee schedule overview, more especially for nutrition and housing in HRSN, under HRSN umbrella. And while we try to understand these fee schedules and how these are developed, so in order to aid with that understanding, we shall also be providing service definitions for both nutrition benefits as well as housing benefits. Next slide, please. These are some of our Zoom housekeeping pointers. Please use the chat function to submit your questions. A will keep an eye on this during our presentation. And then if you would also like to ask your questions verbally, please raise your hand during our question and answer sessions. We'll have 2 question and answer sessions, which I'll be going through in our agenda. This webinar is also being recorded. It will be shared with participants like in the past, following the conclusion of our presentation. For live captioning, please click on the CC button located at the bottom of your screen, or click the link provided for Spanish captioning. For live interpretation guidance, we do have the services available today. So please click on the interpretation button and choose either English or Spanish, whichever you feel comfortable with. Next slide, please. Now, like in the previous sessions, we will continue with our group polls. First, we will have a poll for the counties you are representing. Can we run that, Trevor? Yes. That's great. $36, $39. That's awesome. Till now, 50% have participated. This poll will help us reach out to you and see if some counties are not being represented well, and if we can do anything to aid that. So 66, 67%. Now we are stable at 68. Are there anyone else? Please feel free to. Yes, nice. 72. 73% now. 75. And we are stable on it now. Let's try to reach 100. While you attend this, please feel free to give me suggestions on how we can make these sessions more interactive, so information is entertaining and more palatable. Thank you. I've admitted the rest of people waiting in the waiting room now. So 72 people out of 112 have already attended the poll. Should we stop it here, Trevor? Now we are showing the poll for which sectors you are aligned to. Again, this will help us find out how many of you are from which sectors, and if we need to reach out to more from your sectors and what we are missing. Lovely, 66%. Seven. We'll give one more minute. Lovely. Some 71% have already attended. Six more seconds. Perfect. Thank you very much. Now I think we can stop. Lovely. Can we see the results, Trevor? Nice. So for the sectors question, 45% are from CBOs. I love that because this is one of the main intentions. One second. Anyways, and then 8% are from CCOs, and we have small percentage from tribal services organizations, tribes and tribal serving organizations too. Thank you so much. Okay. Now we'll continue with our presentation. Can we move to the next one? Now, what you see in your screen is the agenda for today. So first, we'll start with introduction, where we'll give you a little bit of introduction about the waiver, what is Medicaid waiver, and what is Medicaid here in Oregon. And then we'll move on to the HRSN services, that is health-related social needs services. The first one that we'll be focusing on is nutrition services. And as you can see, first we'll talk about service definitions and then fee schedules. And then 10 minutes we have allotted for comments and questions. And similar pattern will be followed for housing services. And then the same comments and questions. Let's move to the next slide, please, Trevor. Perfect. Next one. So now we go on to the Medicaid overview. So as you all are aware, Medicaid is a national public Medicaid assistance program for families and individuals, most individuals. In Oregon, we call it Oregon Health Plan. And again, as you are aware, Oregon Health Plan is a free health coverage available to individuals, that is children, teens, and adults who live in Oregon and meet the certain income and other criteria that are applicable for this coverage. You can apply for OHP, that is Oregon Health Plan, at any time during the year. Please, let's move to the next slide. Trevor, next slide. Yes, thank you. So when we have Oregon Health coverage, Oregon Health Plan coverage, how do we get these services? So these services are provided either through coordinated care organizations, that is CCOs, or through open card services. So CCOs are a coordinated care organization, is a local organization that helps some Oregon Health Plan members use their benefits. Now, these CCOs are made of all types of healthcare providers in any community. They work together to care for OHP members in a certain area or a region of the state. So they might be limited to that area and region. Similarly, those who are not enrolled under a CCO or coordinated care organization get their services through open card, which was also called fee-for-service members. And these services are covered by OHA directly. Next slide, please. Perfect. So now we move on to what is an 1115 Medicaid waiver. So this is just to give you a snippet of what we do. So first is the federal government has a set of rules for each state that must, and these states must follow these standards to get funds from Medicaid. And then states can also ask the federal government for permission to change their Medicaid rules. Now, in this setup, waivers are an opportunity for states to try new ways to use these funds, which are not necessarily the same as other states, but could be too. To use Medicaid funding to design programs that are more suitable for specific population needs. In order to continue with these benefits, states must renew their Medicaid waivers with the federal government every 5 years. Oregon has been using Medicaid waivers since 1994, so this is not the first waiver. And but the recent 1115 Medicaid waiver includes health-related social needs, that is HRSN services, the reason we all are here today. And it was approved for October 1, for October 1, 2022 through September 30, 2027. So it's 5 years. And then waivers are an ongoing collaboration with the government. So now, in order to learn more about how fee schedules are developed, since these programs or these programs under waivers are very specific to the states, we all are trying to make it as or make our policies and rules and regulations. And this is where we need your help and support. So Chelsea Guest now will provide us an overview on how we develop these policies, fee schedules. Sorry, Chelsea.
Great, thank you so much. Hi everyone, I'm Chelsea Guest. I work at OHA as a CCO Finance Director, and I'm leading some of the work on the OHA side in close connection with Mercer, who's going to be doing a lot of the presentation, and I'll pass it over to them in a second. My main job is to work with CCOs on their capitation rates and the work they do between OHA and as a contractor. And in this case, this includes both providers and does impact how the CCOs are reimbursed for how they work with their providers. A key requirement of the waiver is to develop this fee schedule for HRSN services that really cuts through both the CCO's work with the providers and all the way back to OHA. As discussed, this is a waiver and is a demonstration of new services, innovation, working on trying to put something into Medicaid that is not typical. So we are working very closely with CCOs, with providers, with stakeholders, with all, and are here to get your input. This is not all the way down into the final stages, but we are looking for a lot of input and want to make sure these services are successful. The financing of these services is how this fee schedule will be implemented as a maximum rate that can be reimbursed to providers for the services or for the device or for the good and service that's part of the HRSN service package. So for each HRSN service, we need to determine how much that service costs. So what is a fee schedule? Looking at the costs embedded in that service, the salaries, the staffing, all of that. We'll get into more detail about where we look for that. We also look at publicly available information about the providers and how much the service is already being paid for in other places. There's a few ways to get paid for services in OHP. Feel like services is a common thing we're going to say today, so I'm going to work really hard to say that clearly. As discussed, there are two different ways that we can pay for providers to do OHP services. There's in the CCO model, where the CCO is responsible for paying for the provider, and then also in the open card. The fee schedule bridges across both of those sectors as HRSN services start getting online. No matter how the provider is paid, this maximum amount will be part of HRSN reimbursement, and we'll get into details on that. A key component of this fee schedule is really how we get your feedback and how we determine those service prices. We are doing our best to gather feedback across a variety of groups, including other states. North Carolina and California have implemented many of these services already, so we'll see those names come up. It's because we're trying to look at other Medicaid programs that have tried to do innovative service delivery for housing and some of the other services that may not be everything that we want to look at for Oregon. So we want to get your input on how our program may look different, or how we need to think about unique aspects of the Oregon model and how we fold this in. We want your feedback, and we want to make sure these prices support the delivery of HRSN services broadly. And that includes beyond just what is currently available. We do expect that there's going to be a variety of services we're going to provide or talk about today that may not be all available at one time or for one eligible population. So as we move forward with this, we're getting all of the services in front of you today, but you may not see this package come out and roll out for eligible populations all at one time. But we want to have the fee schedule in a very strong place, so when that new service is ready to go, we have a fee that's been vetted by providers and the community already ready to go in the wings. So we're looking for feedback broadly, but understand that the timeline and when things are done will be different. All that to say, there's a lot to talk about today. Fee schedules are very exciting, and we're really excited to be here today, but really want your feedback. If you have any questions for us, we're happy to talk through that, and we'll have specific designated times to talk through that, and we'll kind of use the moderator to work through that. So I'm going to pass it to Shannon to keep talking about fee schedules, but I just want to welcome you and thank you for your time today. Go ahead, Shannon.
Thanks, Chelsea. Good afternoon. As Chelsea noted, I'm Shannon Kojisoy. I am part of Mercer, a consulting organization working with Chelsea and OHA to develop the fee schedules. Chelsea provided a bit of information on what a fee schedule is and why we need to create one. I want to just briefly share what information is used to develop a fee schedule, essentially looking at what our subject matter experts review to determine what may be an appropriate price for a service. So as you can see on this slide, the main information required is a service name, service description, frequency of the service, duration of service, setting of the service, and then that provider type or vendor type, looking to get those details as to the title, the education of those who are providing this service. These details provide us information about the service so we can start to develop a price. Understanding who the provider is helps us determine how much those providers are typically paid, a doctor versus a social worker, for example. Understanding where the service is provided helps us determine if travel costs should be included or other overhead costs. In addition, we may consider minimum eligibility requirement criteria, corresponding service requirements, or bundled activities. Bundled activities is really pricing 2 or more activities or services in one price because the services are always provided together. An example of this may be combining rent and utilities into one price. Service limits, this is the cap on how many services can be provided, maybe another input. An example of this you'll see today is that some members may only be allowed to receive 6 months of rent. So the service limit is that 6 months of rent. Once this information is received and understood, we will then determine if there are already established Medicaid fees, established fees in other state agencies, or if the service requires new fee development. We'll go to the next slide. And you'll see on this slide really provides an overview of the 3 steps we assess in development of service pricing. First, we check Medicaid programs within Oregon. We want to determine if already established fees can be leveraged for service already covered elsewhere in Medicaid. In review of Medicaid programs, we'll look to compare service descriptions to HRSN services, compare unit definitions. So again, is it a month? Is it a week? That would be that unit. And then update pricing if needed. If we find similar services, we assess the units and how they are defined and update pricing as appropriate. Similar services in Medicaid programs are strong price indicators, as Chelsea shared earlier. Our second step is we check other state agencies within Oregon. We want to determine if there's already established fees that can be leveraged for services already offered through other non-Medicaid state programs and agencies. In review, we again look to compare those service descriptions to HRSN services, again, compare those unit definitions, and this time we'll evaluate pricing differences and adjust if needed, just recognizing as non-Medicaid agencies, they may have different pricing requirements. Lastly, when there are no established fees that can be leveraged, we develop new rates for services. These are services that are not already offered through the Medicaid program or other state programs and agencies. With this groundbreaking program, this was often the case. In order to develop new fees, we assessed Medicaid fees and state agencies across the nation. We also examined available pricing in Oregon, reviewed other state program fees when applicable, and where needed, conducted a ground-up build-up of rates. In addition, we also gathered input from small groups of HRSN providers and a little feedback from CCOs. And this will continue following today's review. So today, we will review proposed pricing developed with this initial Oregon feedback. And depending on your feedback, prices may be further assessed. My colleague Laura Bass will provide an overview of pricing following a presentation on the services definitions, and the slides presenting the proposed pricing will be structured to highlight information that aligns with this slide. So you'll see that Medicaid fees, other state agencies, and new fee development. I will now hand it over to Julie Reeder, who will present more information about the HRSN nutrition services. Hey, Julie.
Thank you. Okay, good afternoon, everyone. I'm Julie Reeder. I'm the Senior Policy Analyst with the Health Related Services Nutrition. And in order to facilitate our discussion of the fee schedule today, I'm going to briefly review the nutrition services and what is approved by CMS. So next slide, please. Thank you. So as a high-level overview of the nutrition services that are offered, these are intended to be wraparound services, so they can serve people who are already getting SNAP or WIC or other nutrition supports. The key services are an assessment for medically tailored meals. So that is a session typically with a registered dietitian nutritionist strongly preferably an RD for that, or if necessary, a primary care provider to develop a medically appropriate nutrition care plan. Second are medically tailored meals. So these are meals tailored to support members' health-related conditions for which nutrition supports would improve health outcomes. There is a fruit and vegetable benefit as well. Pantry stocking and meals are available to pregnant individuals, children, and young adults with special health care needs. Pantry stocking is a dollar amount to purchase essentially the typical market basket at retail grocery outlets, and it's aimed at promoting improved nutrition for the member. Meals are a hot meal alternative for people for whom pantry stocking would not be an option. And certainly last but not least, nutrition education, which is a combination of educational strategies designed to motivate and facilitate adoption of food choices and other health-related education. Next up, please. Thank you. So a little more details about medically tailored meals. Again, these are meals tailored to support a specific health-related condition for which nutrition supports would improve health outcomes. So one that we're all probably familiar with would be diabetes, for example, but there are many other health conditions that could be supported by medically tailored meals. And so this includes the preparation and provision of the prescribed meals consistent with the nutrition care plan, and it also includes delivery of the meals. So one flexibility that we were able to get from CMS, considering that we are focusing on houseless individuals in one of our populations, is that we are allowed to include some extra fluids or drinks for people who may not have access to potable water. And perhaps we call supplemental food items, but these are snack items, essential healthy snack items that could help someone who needs to take medication along with food multiple times a day. So providers of the service must be at a minimum able to provide 1 meal a day or 5 or more deals a way, 5 or more meals per week, except in rural areas where you might be able to deliver a larger quantity at one time because it's difficult to drive out. So one of the key things as well is that members receiving 3 meals a day through medically tailored meals would not be eligible for the pantry stocking benefit or the fruit and vegetable benefit. So medically tailored meals, if you're receiving that up to the maximum, you wouldn't be eligible for the other services. Next up, please. So again, assessment for medically tailored meals. And so in some respects, this might be a bundled service. And so this is assessment with a registered dietitian nutritionist. That's a strong preference for that, or if not available, a licensed primary care provider to develop medically appropriate nutrition care plan specific to the medically tailored meals service. This can also include a reassessment if needed to understand, whether this is meeting the individual's needs and whether changes need to be made based on health status. So there needs to be an initial assessment before the provision of medically tailored meals. And then assessments and reassessments can be in person, phone, or remote video type visits. Next, please. Thanks. So pantry stocking is the provision of funds to specifically purchase foods. So this is only allowed for food items aimed at promoting improved nutrition for the member. And so there are things like fruits and vegetables, could be meat, poultry, fish, it could be plant-based proteins, dairy and dairy alternatives, bread, cereals, grains, seeds and plants. So essentially a lot of the same restrictions or inclusions that come with the SNAP program for pantry stocking. Again, this is available only to children under 21, young adults with special healthcare needs, and pregnant members who also meet the additional eligibility criteria, being in the transition population and meeting the social risk. So the pantry stocking could be delivered through a voucher or a prepaid card. Again, it would be restricted just to purchasing food items and of course not alcohol. They can pick up grocery shop as you would normally, or they could have food delivered. That could be part of the price as well. Folks that are receiving pantry stocking would not also receive the fruit and veggie benefit, as the pantry stocking allows for purchase of produce. And then for the housing services, which we're going to talk about here later in the presentation, is that there's a housing pantry stocking that occurs at 1 month, at the month of move-in. And so if you're receiving that pantry stock for that 1 month, you wouldn't also get our nutrition pantry stock. But after that initial move-in pantry stock under housing, you could receive our pantry stocking in nutrition as appropriate. Next, please. Thank you. So the meals component, again, this is limited to children under 21, young adults with special health care needs, and pregnant members. And this is really meant to be an alternative for people who really can't pantry stock because you don't have anywhere to safely store foods or prepare foods. It can also be if you're thinking about assisting a member with maybe going to a therapy session or connecting with their parole officer, or whatever the case is, where really being able to pick up a hot meal would really assist them in really, sort of completing what they need to do to move forward. And so again, this is an option for people who require a hot meal. So if you're living in your car, for example. Again, this can be administered through a voucher or a prepaid card or an agreement with a restaurant establishment to do this. They can pick up the food, they can eat at the restaurant. And okay, thanks. We'll get to that, Misha, on the upper limit for Weishen. Thank you. And then again, this wouldn't be something that you would be receiving along with medically tailored meals. So to be clear, meals, we're really thinking about hot meal or hot item that you might pick up from a grocery store or a restaurant. And that's different than medically tailored meals, which are very specific to a certain health condition and are delivered. Next step, please. Thanks. And again, certainly last but not least is nutrition education. And so this is a combination of educational strategies designed to motivate and facilitate voluntary adoption of food choices and nutrition-related behaviors conducive to health and well-being. It could be group nutrition education or one-on-one nutrition education. It could also be meal preparation, so cooking classes, either one-on-one or in a group setting. And so certainly looking at existing providers out there that are able to give training. So it could be things like SNAP Ed, some CDC training. So we are certainly looking for those who are going to be doing nutrition education to have some relevant training and background. Of course, if you're a registered dietitian, if that curriculum is overseen, that would be the licensure that we would be looking for. But in other cases for nutrition ed, we just want to know that you're using some sort of approved curriculum and there's some evidence base to what you're sharing. And so again, people who are getting medical nutrition therapy, which is a higher level of care than would be true for typical general nutrition education, they would not be eligible for this service if they're receiving that through the Oregon Health Plan. And with that, thank you. We'll get to that. Thank you, Jill. Next up. And finally, the fruit and vegetable benefit. So this is a specific dollar amount to purchase specifically fruits and vegetables and culinary herbs. That can be from a regular retail establishment. It could be farmer's market. It could be a farm stand. It could be a CSA, so community supported agriculture. And it can be all forms, so fresh, frozen, or canned. Again, this will be delivered through, it could be vouchers, it could be prepaid cards, it could be any of the systems that are used typically now for a fruit and veggie benefit. They can pick that up from the retailer or the farm stand or the farmer's market or CSA drop site that also allows that to be delivered. Again, this service has to be tailored to health risk, certain nutrition sensitive conditions, or some sort of demonstrated outcome improvement for health. So that is a thread that runs through all of the nutrition services. And again, fruit and vegetables are eligible for most of the transition populations, again, unless you're receiving medically tailored meals, or if you are receiving pantry stocking where you're already allowed to purchase produce. And with that, I think that is our last one, and I will be passing it on to Laura to talk about the proposed fees for this particular piece. Thanks. And Celeste, and so really for nutrition education, essentially everyone, unless you're receiving medical nutrition therapy through Medicaid is eligible for nutrition ed. More nutrition ed for everyone is fantastic. So take it away, Laura. Thanks.
Thanks, Julie. Hello, everyone. I'm Laura Bass. I'm an actuary with Mercer. As noted earlier, I'm going to share the proposed price for each service and provide some background on how the price was developed. We're interested in hearing your feedback on the proposed prices shared today, including any supporting documentation that you'd like to add. As my colleague Shannon shared, we assessed service pricing in 3 steps. First, we reviewed Oregon Medicaid fees. Second, we reviewed other state agencies in Oregon. And then we looked at other state Medicaid agencies and other sources. For each slide with proposed pricing, we show the main price points and data points considered for the service. And we also show the range of prices from some of the feedback that we have already received. This slide presents the proposed price for nutrition education, which is education and information provided around food-related behaviors. It can include meal preparation in individual or group settings, as Julie said, and it's provided by staff with varied or optional training, certification, and licensure. So the proposed price for nutrition education is $12.50 per 15 minutes. We'll talk about MTM assessment on a different slide, but essentially the provider can bill as many 15-minute increments as, as many 15-minute increments as are appropriate based on the time spent providing the service. And there's a broad variety of services here, no requirement for specialized providers. So we've got a whole bunch of data points down here, starting with Oregon Medicaid that already pays for members to have things like group therapy and diabetes prevention program classes, which we expect use staff with similar qualifications as those that would provide nutrition education to HRSN members. These services are currently paid $11.50 to $12 per 15 minutes. And then we've got some related service data points here that are a little bit more associated with that MTM assessment service that we'll talk about on a different slide. So skipping the related service section, looking at actually this service in other states, we've got $13.27 per 15 minutes for food and nutrition access case management in North Carolina, $10.42 per 15 minutes for services provided by a dietitian employee in California, approximately $11.40 per 15 minutes for group nutrition class in North Carolina, and approximately $11.33 per 15 minutes for a nutrition class based on estimates provided by Cooking Matters, which is a nonprofit entity. And then in the bottom right, as noted, we reviewed a statewide survey providing prices, so in the middle section, my bad, we reviewed a statewide survey providing prices for all types of payers by provider type, and we found $13.85 per 15 minutes was a payment for services provided by a registered nurse, and approximately $12.78 per 15 minutes was the payment for services provided by a dietitian employee. So based on these data points, again, skipping over those MTM assessment data points that are under the related service, we've landed at the $12.50 per 15 minutes. You'll see when we look at MTM assessment, all of these rates are lower than the related service data points, which makes sense due to the different staff credential requirements that we can talk about. Although these prices are below the range of feedback received in the bottom right of the slide, the proposed price aligns with the pricing methodology previously discussed. And it's also worth noting that a provider could bill for every eligible member who attends a group class. So doing that would assist with covering additional materials and supplies like food and so forth that would be used by each additional member at a group class. So that would bring the total average payment more in line with the feedback received from entities in Oregon beyond our research. Next slide. Thanks. All right, pantry stocking. So pantry stocking can include an assortment of food and non-alcoholic beverages covering approximately 80% of a member's dietary intake, including consideration for a member's household size, existing assistance, and delivery if available. Here we reviewed a wide range of possible prices. So thinking about food just in general, we've noted that the related service of HRSN meals or medically tailored meals, which we'll talk about on other slides, is going to be around $6 to $13. Looking, however, at groceries or food boxes in other states, we found prices as low as $7.43 to $11.56 per day in California, roughly $13.83 per day in North Carolina, and roughly $16.67 per day in New Jersey. We also gathered feedback for a related housing service that covers pantry stocking when a member moves into a house. However, this had a wide range of prices from $200 to $1,000, and it did not align very well with the particular circumstances or timing for this specific nutrition benefit. So these prices certainly reflect a wide range of potential prices for the service. And so given this, we focused on the guidance that's been provided to Mercer in the detailed service description, that this service is intended to cover up to approximately 80% of a member's dietary intake as based on the USDA Thrifty Food Plan for members not receiving other nutrition assistance. The Thrifty Food Plan outlines nutrient-dense foods and beverages, their amounts and associated costs that can be purchased on a limited budget to support a healthy diet through nutritious meals and snacks at home. And so thus, we identified the maximum rate from USDA, the U.S. Department of Agriculture, as $10.19 per day. And we calculated approximately 80% of that, arriving at $8 per day or $56 per week per person. Next slide. Right. Meals. Perfect. So the meal service can be hot food, meal kits, or restaurant meals, and can include delivery if available. For this service, we're proposing $9 per meal. Here we've considered in Oregon Medicaid, they're already paying for meals through home and community-based services and non-emergent medical transportation. These services are not exactly the same as this meal service, as they're provided to different people like the elderly, or in different circumstances, like when people are traveling. But the range of $9 to $12.25 per meal provides some guidance on what might be appropriate. We also considered the same $10.50 per meal that is paid for Meals on Wheels in Multnomah and Washington counties in Oregon. And then looking at other states, we noted the $7 to $7.60 per meal per delivered meal in North Carolina, and $6 to $12.79 per meal for various senior meal programs throughout the country. We also kept in mind that the medically tailored meals service, which we'll speak to on a different slide, is very prescriptive. It involves that assessment. And so based on some feedback from entities in Oregon and the relativities between the services, we received anywhere from $10 to $15 per meal, and here we're actually setting it at $9 per meal as our proposed price right now. Ultimately, we understand that the meal planning that goes into this sort of meal is less intensive than a medically tailored meal. So we'll see that that's reflected in North Carolina's pricing between the two services. And so you'll see that we are proposing pricing for this service that is slightly lower than what we'll propose for medically tailored meals as well. Next slide. Fruit and vegetable benefit. All right. So the fruit and vegetable benefit provides fresh, frozen, or canned fruits, vegetables, and or culinary herbs to cover approximately 80% of a member's dietary intake. This also includes consideration for a member's household size, existing assistance, and delivery if available. Similar to pantry stocking, we reviewed a wide range of possible prices. So as we're starting to see on other slides, just food-related services in general include the HRSN meals and the medically tailored meals, which we'll talk about, and the HRSN pantry stocking, which we've talked about. However, these services cover more types of food than just this fruit and vegetable benefit. We identified the Women, Infants, and Children, or WIC program, and we understand that pays up to $1.71 per day. We found in other states, North Carolina pays $6.92 per day, and Massachusetts has various programs that pay between $5.71 and $6.57 per day. Again, we also gathered feedback from entities in Oregon beyond our research, and that indicated anywhere from $4 to $14 per day for this service. So similar to pantry stocking, given the wide range of prices, we focused on the service description guidance to cover approximately 80% of a member's dietary intake for members not receiving any other nutrition assistance. In this case, we looked at USDA guidelines and data indicating a price of up to $2.60 per day. Based on the USDA data compared to that USDA Thrifty Food Plan, which we leveraged for the pantry stocking service, we estimated approximately 30% of food cost should go toward fruit and vegetables. And so we applied that 30% factor to the pantry stocking service rate, and that's how we calculated the $2.40 per day or $16.80 per week per person for fruit and vegetables. Next slide. All right. So this slide provides a quick review of the proposed pricing for all the services. So as I mentioned, medically tailored meals, which is based on a lot of the similar data points we discussed for meals, is priced at $10 per meal, which is more than the meals price. Again, thinking about the intensity of the meal planning. MTM assessment has a proposed price of $25 per 15 minutes. Pantry stocking has a proposed price of $56 per week per person. We discussed that. Meals with its proposed price of $9 per meal. Fruit and vegetable benefit, $16.80 per week per person. Again, spoke to that. And nutrition education with its proposed price of $12.50 per 15 minutes. So as I noted earlier, these are prices that are based on our research and Oregon Health Authority staff feedback, among other feedback, and we are interested in hearing feedback from all of you before these prices get finalized. Trevor, did we happen to skip over the MTM assessment slide if we go back a few? Here we go. Can we go back one more? Okay, here we go. All right. Here's the medically tailored meal slide, which I mentioned. So as Julie shared, these are meals designed to meet the needs of individuals with health-related conditions for which nutrition supports would improve health outcomes. As I mentioned, we're proposing $10 per meal for this service. We talked about the instances where Oregon Medicaid is already paying for meals through HCBS and NEMT. But again, these services are not exactly the same, given that they're provided to different people or in different circumstances, but that $9 to $12.25 range per meal provides some guidance. We were aware of the $10.50 for Meals on Wheels, though that's not really a medically tailored meal, but it's still food and meal related. And then we've got other states that have priced the same service. So medically tailored meals being $7.80 in North Carolina and approximately $9.50 in California. And then these states also had the related services of the plain old meals, which we talked about already. And then lastly, we've got our feedback from entities in Oregon beyond our research, and that feedback indicated a price of $10 to $15 per meal. So that's how we got to our $10 per meal price. And then next slide is the MTM assessment. All right, so this slide presents the proposed price for the medically tailored meal assessment. This pays the registered dietitian nutritionist, RDN, or the primary care physician, PCP, who will provide the assessment and optional reassessments. As time for the assessment and reassessment may vary, we are proposing a price of $25 per 15 minutes of work done on that member's assessment. And so a provider could charge for 30 minutes or 60 minutes or some other increment, depending on that actual time spent, and would get paid $25 per 15 minutes. So Oregon Medicaid already pays for members to have these types of assessments. They are currently paying at $27.36 per 15 minutes for the initial assessment and $23.38 for the reassessments. So as our methodology emphasizes using existing Oregon Medicaid fees where appropriate, we set the single rate for this service at $25 per 15 minutes. But we also looked at other data points. We found that California pays for nutritional assessments at $24.50 per 15 minutes, further supporting our proposed price. And we did collect, as I said, all the other information on this slide. The other prices included Oregon Medicaid rates for these related services, which we talked about, the group therapy and so forth. A statewide survey of payments for similar employee types. So that's the registered nurse and the dietitian in the middle column. And then the rates in other states and national programs, and as well feedback from entities in Oregon beyond our research. However, these data points were all for that related service of nutrition education, which we discussed on a different slide. And so while this related service does involve providers meeting with members to discuss nutrition, that nutrition education service is not a formal assessment, and it doesn't require the specific types of credentialed providers that are needed for this formal MTM assessment. Thus, these rates, the nutrition education rates, tended to be quite a bit lower than the MTM assessment price. And so due to the differences in the services, we're proposing that $25 per 15-minute rate for MTM assessment, which aligns with the current rates provided by Medicaid. All right, so I think we can skip forward a few slides over to that summary. And I will actually hand the discussion back over to Satya, who will facilitate a short question and comment period before we move on to housing services.
Perfect. Thank you, Laura. That was a great presentation. There is a question in the chat. If for delivery of any of these services, is the price listed in, does it include the delivery fee too? Do we have any answer for that?
Deliveries included in the price listed.
Perfect. Thank you. And the rest of the questions, someone also has asked, does these fees go up by a certain percentage over time with inflation?
So there is a plan that prices would be reassessed periodically. I don't currently have a firm timeline or frequency for that. The short answer is yes.
Perfect. Also for our partners, since we are currently working on these prices, it would be really helpful if you all think that these prices are not really fair or that it should be changed, then please do provide us the current rates that you are working on or have provided services. And this documentation will help us provide supporting evidence for why we are proposing increased rates. So thank you so much. Now let's move on to the housing session. And now Callie will take over.
I guess there was that one question that she's asked twice, and so I want to address the
certification. Okay.
Question about certification, and so certainly for the medically tailored meals assessment, that would be a registered dietitian or primary care provider. For nutrition education, there doesn't necessarily need to be a specific degree or certification. And I know that question was also in the chat about, will there be more information about different curriculums and different training. So I'd say this person needs to have training, and we need to be thoughtful about what the curriculum is that we're using, and we can certainly follow up and continue dialogue on what that would be. We've got a lot of different populations that we're looking at in the transition populations, and so there isn't a one size fits all curriculum for all of those potential audiences, and so we're looking at that and would like to continue to dialogue about that. And so I just wanted to make sure, since I've seen several questions, that we didn't skip that.
Yes. And the rest of the questions that have been unanswered, we'll provide the feedback for it through our emails and other forms. And regarding these outreach and engagement support, we'll have another session on it for nutrition and housing. In our next session, we'll be talking about outreach and engagement supports for our currently live climate supports. So thank you so much. Let's move on to housing now. Callie.
Yeah, and I can appreciate that we're going a little quick. Can folks hear me okay? I'm getting a bit of a feedback.
Yes, we can hear you.
Okay, great. Actually, I think can you still hear me?
Yeah.
Okay.
Yes.
With that, something must have been wrong with my my headset. I'll be presenting the service descriptions for housing, similar to what Julie did for nutrition, and then hand it over to Mercer to go over the fees. I'm going to go slightly quickly through housing, one, because I want to make sure that there's time to answer questions, and also because I presented many of these during our housing partner work session, and I think and hope that many of you attended that. So without further ado, next slide. So this is our current eligibility framework for housing. I just want to flag that we're still in draft form with service descriptions as well as eligibility, but wanted to share what we have so far, caveating that things could certainly change. So our current eligibility framework is people who are meeting the HUD HUD definition for at risk of homelessness and need support maintaining their current housing, plus a clinical risk criteria, and then would receive the following housing services. So we'll dive into housing eligibility, I think, at a later date, but I wanted just to cue that up for you all to keep in mind as we move forward. Next slide, please. So a high-level overview of HRSN housing services. We have rent, which has gotten the most attention probably, but I do think we have some other services that are also very exciting. We have utility costs, which go hand in hand with the rent benefit. We also have a case management service. So that includes pre-tenancy, housing navigation, and tenancy sustaining services. We also have medically necessary home modifications and remediations to keep people healthy and safe in their homes, and move-in supports. So you'll notice we do have a focus on helping people maintain their current housing. And so we're still working on the ways of phasing this out and eligibility to enable all services to go live. So again, this work is in somewhat of a draft form, and you'll receive more from us as we move forward and take feedback into account. Okay, next slide. So this is our first one, rent and temporary housing and utilities cost. We've grouped these two services together because oftentimes people are charged rent and utilities at the same time. It covers utilities for a wide range of utility costs for a wide range of utilities, but does not include pet fees and parking garage fees, amenity fees, etc. We do cover internet and phone costs. So people must be receiving the rent benefit in order to qualify for the utilities benefit. This is because of CMS guidance or requirements rather. So we're not able to separate utilities costs on its own. The presumption is that an individual will need 6 months of assistance, and it's really capped at that 6 months. And individuals are only eligible once per the demonstration period. And the demonstration lasts until September 2027. Next slide. Utility arrears and setup. So we've heard feedback that folks can get into quite a few number of months in arrears. This service description allows for us to pay utility arrears for up to 6 months and for the setup of utilities. I'll also note in the previous service description for rental assistance, we also allow for rent arrears, but the total amount would be 6 months. So if someone is 3 months in arrears and 3 months moving forward, that would be eligible under this benefit because the total is 6 months. Next slide. So this is one that I think is really exciting about HRSN. This is our kind of case management related service description, and it covers pre-tenancy, housing transition navigation, and tenancy sustaining services. And examples of these activities include working with the member to develop a housing plan that supports their needs, reviewing and updating and implementing that plan. So that could include regular visits and check-ins, coordinating referrals, coordinating the provision of these other housing services, coordinating move-in support, ensuring that the environment is safe, engaging with landlords, and engaging with the CCO. So as I believe you know, because we've gone through the member journey and provider journey with this group, housing providers will be engaging with coordinated care organizations to receive service authorization, and the time spent in coordinating with CCOs is reflected in this service description. Next slide. Great. Okay. Oh, one back. So medically necessary home accessibility modifications. I want to flag that this service description we're kind of actively under discussion, so welcome your feedback here. We are interested in reviewing these activities and seeing what would make the most impact for our members and how the operational lift to implement these. So the types of activities included under this service description would include things like grip bars, handrails, poles, soundproofing, non-skid surfaces. So this is kind of the full range of what this could entail. And I'd love to hear your feedback as to what the most impactful and operationally feasible activities are within this category, this service description. So because these home modifications would be actually completed by a licensed vendor, so might be a carpenter or a plumber or someone like that, we anticipate that housing providers would need to liaise with these individuals to arrange for these services.
So do all services have to be through a licensed provider, or if it's just like making the ramp, since that's not like an electrician or a plumber, can that go through a company like Habitat for Humanity that has our CCB?
Yeah, so they just need to have the appropriate licensure to carry out the activity. We of course wouldn't want someone who didn't know how to install a ramp to be installing a ramp. So, okay, next slide. Home remediations. So similar to home modifications, we're kind of in an active feedback time right now to understand what remediations would be the most impactful. We've heard, for example, that chore services, so also called muck outs, or kind of the heavy duty cleaning, is particularly impactful for individuals who have a hoarding disorder or to help children stay in their homes. And pest eradication, similarly, potentially carpet removal, installation of washable curtains, mold removal. So these services are currently eligible for members to receive as often as necessary to eliminate home-based health and safety risks. And similar to the home modifications, we are requiring state licensed vendors for things like pest eradication or mold removal to make sure that appropriate procedures and practices are followed. Next slide. Hotel and motel stays. This service is currently framed to enable folks to stay in hotels and motels as needed to enable home modifications and home remediations. Next slide. Relocation expenses. So as I mentioned earlier, we're still working on our eligibility for this. We have wanted to, for rent and other aspects of the housing benefit, the intent is to focus on people who meet the at-risk of homelessness definition and need support maintaining their housing. So we're still working on some of these service descriptions that are kind of talking about moving into new housing. So an example could be someone who needs to move to a more affordable house than what they currently have. That's kind of an example of what we're thinking about, and curious to receive feedback on this. But relocation expenses, this provides transportation of a member's property to a new destination, the packing and moving and unpacking of household goods and furnitures, and any work to move household appliances or other property. And this benefit is for people, the time frame is once per move. So obviously you wouldn't have relocation expenses if you weren't moving. Next slide. Security deposit at move-in. So this is the provision of payments for deposits needed to secure housing. Also eligible once per move. And first and last month's rent, also eligible once per move. And so this is if the landlord requires a first and last month's rent to secure the housing, that would be what this is for. And I'll also just note per CMS requirements, we're doing 6 months total. So the first and last month's rent at move-in would then mean 4 monthly payments of rent. Next slide. One-time pantry stocking. This is also a cost or a service description that is connected with moves. So members would be eligible for this one time per move. As Julie mentioned, it differs from the nutrition benefit in that it's connected to a move and it's a one-time cost as opposed to a reoccurring monthly pantry stocking. But similar to nutrition, it includes things like fruits and vegetables, proteins, legumes, dairy products, breads and cereals, etc. And there is flexibility in terms of how it is administered and how it is either delivered or picked up. Next slide. Household goods and furniture at move-in. So again, connected with moving costs, eligible once per move. This is the provision of payment for basic household goods and furniture that is necessary for the member to establish a household and may include the following. And we've left these like fairly general to give the flexibility needed for people to get what they need to start a household, but hopefully provided enough specificity to communicate what we intend. Next slide. Storage fees. So this is the provision of payment for storage for personal property to facilitate moving or a transition period. To be eligible for this benefit, a member must be receiving the rent benefit or the relocation expenses benefit and be moving. And they would receive this one time per move, if so. And similar to the rent, members could receive this for up to 6 months. Next slide. Housing application fees. So the provision of payment of housing application fees, this is as needed to secure housing. So we anticipate that depending on the housing navigation and the housing availability in your area, people may need to apply to multiple places to live before they get one. So that's what this one is about. Next. Great. Okay, with that, I will hand it probably back over to Laura to go through individual costs. Thank you.
Thanks, Callie. So this first slide is on the rent or temporary housing and utility cost service. This will pay for recurring rent, renter's insurance, and or utilities, including internet and phone for the member's household. Currently, there are no services that are the same or very similar that are paid by Oregon Medicaid. However, we found that Portland's regional long-term rent assistance program reimburses up to 120% of fair market rent. And we also found that North Carolina Medicaid is covering up to 110% of fair market rent. Fair market rent is published by the U.S. Department of Housing and Urban Development, or HUD, and represents the cost to rent a moderately priced dwelling unit in the local market. On this slide, we've noted some feedback that we received regarding various services related to places for people to stay, whether that's rent or hotels and motels, and also the utilities. We're also showing the fair market rent for Oregon and noted that we looked into the schedule of utility allowances from some housing authorities in Oregon. Given the wide range of rent and utility rates, which vary by region and unit size, we opted to develop a grid for the rates, which we'll see on the next slide. As we developed that grid, we kept in mind that this service would only last for up to 6 months, and people would have to transition to a different way of paying for rent. So we wanted some consistency with other programs. Accordingly, we tried to base pricing to around 120% of fair market rent based on our research, and we kept in mind that $3,800 was the maximum implied by the feedback we received from entities in Oregon beyond our research. So that would be the $3,000 per month for rent at the upper limit and the roughly $800 per month for utilities at the upper limit. Before we go to the grid on the next slide, I want to note that we're proposing dividing the monthly rate by 28 to get a daily rate for instances where a landlord charges a per diem to pay for partial months, like if a member moves in a few days early. Next slide. Thanks. So on the last slide, I shared the thought process behind the pricing for rent and temporary housing and utility costs. This slide outlines the prices by region and unit size, number of bedrooms. So starting from the top of the slide, we've divided the pricing into 5 regions. The counties for each region are indicated in the grid. The most expensive monthly rates are in Region A on the left, and the least expensive monthly rates are in Region E on the right. Pricing is listed under each region for a 0 to 1 bedroom unit, a 2-bedroom unit, and 3 or more bedroom home. As discussed, each monthly rent is largely based on 120% of the fair market rent in Oregon for the indicated counties. We also included additional amounts for utilities that are included in this benefit, but that we understand are not part of the fair market rent developed by the U.S. Department of Housing and Urban Development. So this includes estimates for phone and internet and renter's insurance. The other 3 services listed on this slide are priced based on the same grid. So first and last month's rent at move-in covers first and last month's rent if it's required by the landlord to move in. That's paid once per move for the member's household. And although this service does not include the extra utilities like internet and phone, we're proposing a price each month that's just the same as the amounts noted in the grid. Similarly, the security deposit at move-in is a deposit needed to secure housing and will be allowed once per move for the member's household. So based on some research and feedback we received, we're proposing a price that is also the same as the amounts noted in the grid. And then lastly, we've got utilities arrears. That's a payment for costs related to unpaid utility bills, including internet and phone. For each month of unpaid utility bills, we're proposing a rate of 40% of what's shown in the grid. Based on our review of utility costs for various household sizes and regions, we believe this is an appropriate limit to cover all the utilities that may be past due when they're not paid with rent. It equates to $520 at the lower bound to $1,560 per month at the upper bound. And that's double the monthly utility amount from the feedback we received and showed on the previous slide. Next slide. The utility setup will cover the one-time payment for utility setup or restart costs, as well as the first month of utility payment. So similar to the utilities arrears service, we're proposing that 40% of the normal monthly rent and utility benefit amount for the payment, plus an extra amount for the startup or restart costs. To develop the setup or restart cost, we found that North Carolina priced utility reinstatement, utility deposits, and utility arrears as up to $500 for each of those services. And we also received feedback indicating up to $250 each instance of setup costs, first month utility payment, and first month phone costs. So striking a balance between the available price points, we're proposing $350 as that additional amount for the setup or restart costs. And so in total, you'd have the $350 plus 40% of that grid. Next slide. All right, pre-tenancy, housing transition navigation, and tenancy support. So this is a service provided to help Medicaid members achieve and maintain housing stability goals. As Callie shared earlier, it's a service that can be provided in many instances, but at its core, it's time spent by a person in support of a member. This is similar to the outreach and engagement service that's currently provided in support of the HRSN climate services in Oregon Medicaid. And thus we're proposing a consistent price of $20 per 15 minutes. We did not find other state agencies services that were similar to this service in Oregon. And when looking for other price points and soliciting feedback, we found PMPM or per instance rates, which are both different units of measure than our proposed price. A PMPM is a per member per month amount that is provided to a service provider who's supporting a member. A PMPM does not require that the provider bill in 15-minute increments. However, it may require similar documentation be captured and submitted with the claim. So we're looking into developing a PMPM for this service in the future, but right now we're just sharing and proposing the per 15-minute price, since that PMPM price will take some more time to determine. That said, we wanted to share the prices that we found with you now while we continue to gather feedback and work on future pricing. So these values are $400 PMPM for housing navigation in North Carolina, approximately $386 PMPM for housing transition navigation in California, approximately $444 PMPM for housing tenancy and sustaining services in California, anywhere from $451 to $564 PMPM based on feedback from entities in Oregon beyond our research, and then anywhere from $43 to $4,000 per instance based on feedback from entities in Oregon beyond our research. And that really highlights the wide range of possible effort needed for any one member, which could span many months. Next slide. Medically necessary home accessibility modifications will pay for work to eliminate known home-based health and safety risks via installation of ramps, handrails, grip bars, and more as appropriate for the member. We are aware that Oregon Medicaid has a K plan that pays up to $5,000 per modification, but we were also made aware that there are often quotes from providers that exceed this limit. So we also found that North Carolina has a $10,000 per lifetime of waiver limit, and California has a $7,500 cap for this service. And so based on these data points, we're proposing a $7,500 per instance limit for this service. And of note, this limit exceeds the feedback that we've received thus far on the cost for this sort of service, which ranged from cheaper things at $100 or less, like grip bars, to approximately $5,000 for things like ramps. Next slide. Medically necessary home remediations will pay for work to eliminate known home-based health and safety risks via heavy house cleaning, pest eradication, and more as appropriate for the member. We didn't find any existing Oregon Medicaid rates or other Oregon state agencies paying for this sort of service, but we did find North Carolina has a $5,000 limit per year for this service, and so we're proposing the same limit. Of note, this limit exceeds the feedback we've received on the cost for this sort of service, which again ranged from $43 for smaller services to upwards of $2,500 for things like installation of washable curtains. Next slide. Right. So this service pays for hotel or motel stays when serving as the primary residence in support of a transition to permanent housing for the member's household. We didn't find any existing Oregon Medicaid rates or other Oregon state agencies paying for this sort of service. We also didn't find other states with this service, so we did some research and considered feedback that we've received from entities in Oregon beyond our research. In our research, we looked into many different factors. We looked by region. We found that the more expensive rent regions appeared to have more hotels and motels competing and therefore slightly lower nightly rates, while the cheaper rent regions had less competition and slightly higher nightly rates for hotels and motels. That said, the rates here are not as significantly different as the rent rates. We looked by room type. So we looked at one king bed that might be suitable for 1 to 2 people, and that's reflected as our simple scenario. We looked at 2 queen beds, which might be suitable for like a family of 4, and that's reflected as a small family. And then we doubled that rate for larger families, assuming in those cases that you might need a second room. So we made sure to include any allowable taxes and fees charged by the hotel. So in other words, no pet fees, parking fees, or amenity fees per the detailed service description that we were provided. And we also considered the cost for rooms booked several days or weeks in advance might be cheaper than rooms booked the same day as check-in. We even checked different types of facilities. So while we did not sample every hotel available, we did look at chain motels as well as more expensive but reasonable, like 3-star sorts of hotels where available, to allow for placement into any suitable and available room. The higher end of the rates we found are shown in the grid. And so based on our findings, we're proposing $100 per night per room, and that is within the range of the feedback we received. Next slide. So relocation expenses is a service that pays for packing, moving, and unpacking of personal property, including materials and labor for the member's household. We didn't find any existing Oregon Medicaid rates or Oregon state agencies paying for this sort of service. We did find that North Carolina priced a general housing move-in support service between $900 and $1,250, depending on household size. And we also did some of our own research, and then, of course, considered feedback received from entities in Oregon beyond our research. There are a lot of moving companies and an infinite number of scenarios for relocation, and from the time of the year to the truck size to the distance. So based on our research, we developed 3 tiers. A simple move is a smaller truck size, like 10 feet to 15 feet, moving a small distance, like within a city or up to about 50 miles away. And so these smaller local moves require less time and materials, and our research indicated roughly $600 would be sufficient. This rate also covers much of the feedback we received. A moderate move is defined here as a small truck, again, suitable for just a few people or maybe a family with less personal property, moving a farther distance. So in this case, the additional mileage had a noticeable impact on pricing. So our research indicated roughly $1,000 might be more appropriate. But considering the North Carolina pricing and the feedback we received, we're actually proposing a rate of $1,200, expecting that these first 2 tiers would cover most moves. And then finally, we have a complex move defined as a large truck, like 26 feet, moving a long distance, like across the state. And for such a move, our research indicated that $1,800 was within reason, which also covered all the feedback that we received. Next slide. Okay. So household goods and furniture at move-in pays for necessary household goods and furniture when a member's household moves into a new residence. This includes things like appliances, cookware, bedding and linens, furnishings, cribs, bathroom supplies, and cleaning and organizing supplies. Again, we didn't find any existing Oregon Medicaid rates or other Oregon state agencies paying for this sort of service. But we did find North Carolina priced a general housing and move-in support service that I mentioned before. So that's between $900 and $1,250, depending on the household size. And so given the many possible scenarios and needs, again, we're proposing here $1,500 per instance for the household. This is largely based on North Carolina's rate and covers much of the feedback that we've received so far. Next slide. So storage fees pays for storage of personal property and belongings for the member. This is a recently created service for which we have not solicited much feedback yet, and so we're particularly keen to hear from you. We didn't find any existing Oregon Medicaid rates or other Oregon state agencies paying for this sort of service. We also didn't find other states providing this service. So we conducted our own additional research, and we found many different types of storage facilities with rates varying significantly across the state and even in local areas. The size of the space seems to matter, as do various benefits like climate control, security features, and more. Ultimately, we're proposing a price of $200 per month, which we hope will cover the needs of members for all sorts of unit sizes, geographic locations, and storage facility features as necessary and appropriate for the situation. Next slide. Housing applications is meant to pay for a member's household for as many applications as necessary until that housing is secured. Again, we didn't find any existing Oregon Medicaid rates or other Oregon state agencies paying for this sort of service. And we also didn't find other states with this service. So in our own research, we found the price of $30 to $50 per application fee was common. And we also received some feedback that application fees could be as high as $100, though we understand that's not common. We were also made aware that the application fee applies to every adult member of the household. So in consideration of this information, we're proposing $75 per application per person. And this price would be provided for every adult member of the household to get their application fee paid under this service for every application needed until that housing is secured. Next slide. All right, so we have reached the summary slide provided to quickly review the proposed pricing for the housing services. The various rent and utility services that are based on that grid of region and bedroom size, that's not included here for the sake of space. And you'll also note that we did not discuss the pantry stocking at move-in service on its own slide. This was presented earlier as part of the nutrition pricing overview, same data points. And so we just didn't share that development of the pricing information a second time, but it's simply calculated as approximately 1 month of the pantry stocking nutrition benefit. So to recap the other services, we have hotel motel stays at $100 per night per room, relocation expenses with a proposed price that varies by distance and truck size and complexity, ranging from $600 for simple moves to $1,200 for small trucks going large distances to $1,800 for large trucks going large distances. And then we've got storage fees at $200 per month, goods and furniture at move-in with a proposed price of $1,500 per instance, housing applications with a proposed price of $75 per instance per person, medically necessary home accessibility modifications with a proposed price of $7,500 per instance, medically necessary home remediations with a proposed price of $5,000 per instance, and then finally that pre-tenancy housing transition navigation and tenancy support with its proposed price of $20 per 15 minutes. So as a reminder, these are prices that are based on our research and Oregon Health Authority staff feedback, among other feedback. And we are interested in hearing feedback from all of you before these prices are finalized. But I'll now hand the discussion back over to Satya, who will facilitate another short question and comment period before we discuss.
Thank you so much, Laura. There are a few questions on the chat and Callie has done an awesome job responding to most of them. There is a question by Kevin about housing rent, like for region A with 3+ bedrooms, would $3,900 be per member per month or not?
Household each month.
Okay.
And just to clarify, because I think I saw this coming through a little bit in the chat, all of these are max allowables. So we don't expect the cost to be at the top end. This is the high end. So the cost will actually come in likely lower than what we're expecting. We're trying to provide some allowance of that. So I wouldn't expect to see everything at the top end in terms of what we come through on cost, but we are providing kind of a benchmark on a statewide basis on what we'd expect for these services. The only exception is the 15-minute tenancy and navigation supports. So when we talk about per instance for home modification, that's, that could range significantly. So we're really trying to give some boundaries on the top end for system and statewide implementation. This also is something where CCOs are going to be contracting with providers and landlords and other entities on a different basis. This is what we will reimburse on the back end, but how they work with their contracted providers is still up to them. And we do expect this to transition to a more at-risk program where the CCO will be negotiating the rates without state reimbursement, which is what we're doing right now. And so we want to make sure those models are sustainable. So just in terms of that, the other thing I just wanted to comment on Kevin's question, that includes utilities and some additional utilities that are outside of typical. So phone and a few other items that Laura may want to mention, and then it is limited to that 6-month service limit related to rent, dependent on the person's eligibility. So I just wanted to make sure that it was clear these are maxes, because they tend to be, you know, a little bit higher than what maybe people are expecting, but that's because we are going to pay at cost, or what the service actually cost to provide to the member underneath the upper bound. Hopefully that's helpful.
Thank you, Chelsea. Does anyone have any questions? We still have time.
So I do see,
Yes.
I see a question in the chat about the frequency of updates. Similar answer to the nutrition services. Rates will be reevaluated. It's not necessarily once a year or more or less frequently. We're still discussing timing with the state, but rates will be updated over time.
Someone has a,
yeah.
Sorry. I think someone has a process question, and Callie just responded that they are, sorry, there is a question: if only services for nutrition and climate, like someone only has or is approved for services or needs services for nutrition and climate, would they pass them to the respective CCO, or should they contact the CCO themselves? Caleb, would you like to ask your question again? Oh. So they are saying if they only offer services for nutrition and climate, would they pass them to the respective CCO, or should they contact the CCO themselves? Does it make any sense?
I think I'm a little confused by the question.
Yeah.
Caleb, do you want to expand on it? Maybe he had to drop. In general, though, I think our member journey might help to answer that question, and it is available on our website, and I can kind of look through and try and find it as we're talking, and paste the link into the chat.
The only thing that I would offer is just that it may depend on your relationship with the housing vendor, and making sure that the service is authorized through the CCO, or if you're doing outreach and engagement services, those types of things. I think that's why there might be multiple answers to this question. But I think working with the CCO is always good in terms of making sure the member is being served.
Great. Thank you, Chelsea. There is another question by Devin. How will the medical necessity be determined for home remediation?
Yeah, sorry, I was looking for the member journey. Yeah, and just paste it in the chat, which might help. So that's a great question. And I think that we have a little bit of work to do on that. Basically, the clinical, so in all of HRSN, we have the covered population plus a clinical risk factor, and then plus a social risk factor. For housing, we have kind of made it so that the social risk factor loops back to the clinical risk factor and the covered populations. That's a little confusing. I guess what you have to know is there's the covered population and the clinical risk factor. So what our task is when we identify these kind of home modifications that make the most impact and that are also likely and feasible to operationalize, then our task at hand is to look at the clinical risk factors that we've been approved to use by CMS and match them up. So we would have, I mean, for some things it's fairly straightforward, widening doorways so a wheelchair can fit through. You would need to have a clinical risk factors that specifies the need for accessibility. So basically those two things should match, and it would be the CCO during the service authorization phase would check to see that those matched. I hope that helps.
I can respond to the upper limit if that works, Satya.
Yes.
I think Misha Marie asked about the upper limit on pre-tenancy housing navigation and tenancy services. Currently, there is a cap, and we plan on adjusting the cap, and we'll talk about outreach and engagement specifically at the next meeting on the 16th. Related to navigation itself, there's not a cap that we're planning on putting forward related to the payment. It is something that we'll be monitoring and ensuring it's connected to service delivery and effective. Obviously, that's an important piece of evaluation, but there's no cap that we're planning on suggesting for housing navigation at this point. We understand the complexity is very unique by individual. I also saw some questions related to indirect and direct services on behalf of members. That is covered under the definition as well. And I do think we are looking for ways to improve administrative burden related to navigation services. That's why we're discussing kind of allowing a per member per month option. The CCO and can provide to their contractors, and we would reimburse on the back end at the state level. The one piece that's tricky about that is just understanding that there's so much different complexity for need on housing. So really getting some feedback would be helpful on that, and kind of the needed caseload and things like that related to navigation. So I just wanted to reiterate that we are looking for your feedback on navigation generally. If you think a cap or some kind of additional parameters would be helpful in implementing the service, definitely open to that as well. But currently we're not suggesting that.
Chelsea, do we have a timeline in which we would like this feedback so that we can include them in our policy?
Yeah, I thought we had
23rd April? Does 23rd April is that the timeline we decided on?
I think that sounds right.
Perfect. Yes.
Yeah.
Okay, so please share your feedbacks by 23rd April so that we have enough time to include them, like do a little bit more research on it, design it, and include them in our policies. Thank you so much. I think Caleb, yes, they described their question a little bit more. So their main focus will be for nutrition and climate. And when handling the clients that would be for housing, would they want to give them information to contact the CCO, or should they contact the CCO to help facilitate the client? That's a good question.
I think this is the repeat of what Caleb had asked prior, and I think he clarified it slightly.
Okay.
I do think that it may depend on their contractual relationship with the housing navigator or their engagement. I think soft, warm handoffs are very encouraged throughout the system, but ensuring that the member would qualify for those housing services and be authorized for payment was something I would be encouraging someone to contact the CCO as well. I don't know, Callie, did you think about that a little bit more? Do you have anything else to add?
I don't, and I did put the member journey and provider journey in the chat.
Great.
Do we have any more questions? Yes. Please feel free to send your feedback whenever it occurs to you, and then we'll try our level best to respond to them, or we'll take it up in later sessions. And if we don't have any questions, then we can finish our session for today and give 10 minutes to people back. I'll wait for 5 more minutes. Else, thank you so much for joining us today. Thank you so much.
And maybe if you want to go to the next slide, it might show some of that contact information, I think.
Trevor, next.
We look forward to talking to you all again on the 16th related to outreach and engagement in climate. And I know that there was a question about the next week invite in the chat. And hopefully that's clarifying. It's not next week, it's the 16th.
Yes, it is. Next week this
Is that
time.
next week?
Yeah.
It is next week. Oh my gosh. I just made a mistake. I'm sorry. That was my
No, I
bad.
did respond to that question. We're like, please tune in next week this time. And we have the dry run for it tomorrow.
April is going a little too fast for me, I think.
I know. Same.
Appreciate everyone's feedback.